Hi, everyone. Welcome to Natural Nutmeg Magazine and our weekly podcast. I'm Dr. Diane Hayden, publisher of Natural Nutmeg, and we interview our expert writers and contributors on our weekly podcast on topics ranging from natural medicine, nutrition, green living, spirituality, and how to live a healthier, more holistic lifestyle. I'm excited to have with me today Dr. Jaquel Patterson. She is a nationally recognized naturopathic physician, best-selling author, and sought-after speaker. Her clinical expertise is in Lyme disease, autoimmune conditions, anxiety and depression, allergies, ADHD, and women's health issues. She runs a multidisciplinary practice in Fairfield, Connecticut, and has been practicing for over 12 years. She completed her medical program from the University of Bridgeport College of Naturopathic Medicine and her undergraduate degree from Cornell University, and she is also a Forbes contributor and serves on their expert panels. So thanks so much for being with us today, Dr. Jaquel. How are you?
Good. How are you, Diane? Thank you so much for having me on this important topic, especially, right now with everything going on, as it seems to be, anxiety, ADHD, behavioral pieces, especially as it pertains to our children, is becoming more obvious in terms of management of it during this time. So thank you for having me on.
Of course. Yeah, it's definitely a much needed topic, and, things that parents and all kinds of individuals are struggling with right now for sure. So let's just talk a little bit about, what are you seeing currently in your practice as a result of COVID and everything, and how are you treating that?
Yeah, so right now, well, we're working on obviously a lot of immune support pieces. So, vitamin D, zinc, all of the basic minerals and deficiencies we can do as much to support and help to protect our immune function and support overall. But what is coming up a lot, which I've seen, we actually in our office, I'd say about 40% of our patients have suffered from anxiety or depression or something that kind of disrupts the pattern of behavior in terms of also with their children, ADD and ADHD, which may have been there, but the anxiety that comes along with it is more prevalent. And a lot of that is just the changes. There's been so many lifestyle changes for us, right? So the parent, not only just obviously what's going on in the world with the pandemic, but then now it's really caused outside of those changes, how it's changed in terms of schooling. Sometimes some of the children are doing a mixed hybrid where they're going to school and staying from home, or staying from home taking classes, or they're only staying from home and there's a lot of screen time. And screen time always impacts childhood behavior in terms of, and more significantly for kids with ADD or ADHD, it's much harder to concentrate. It causes a lot of erratic, impulsive, it creates some behavioral changes pretty significantly with the more screen time. There's sleep changes which impact us negatively. But anxiety coupled with everything else that's going on that the family has to manage, in addition to trying to have your kid, be able to, get through the current situation as it pertains to schooling. So I found that some are doing well with it in terms of doing homeschooling or really trying to have their kids at school because there's been a harder ability to focus and have an attention versus at home. And then also the mixed system, the mixed hybrid has been, I've heard conflicting things because it's challenging for a child to create some kind of pattern and continuity. And with kids, it's really important to have structure and patterns. And so this really tilts it the opposite on its head of having any pattern and structure. And so having not only the parent have to adjust to that and that creating some anxiety, but also having the child do that and expecting them to really perform at the same level is just a really difficult task to do. So it's just, fret with a lot of emotions on the entire family. So
Yeah, I would imagine it's like there's hardly any structure at all, really, because even if they're on a hybrid model, 1 minute they're, they have the structure of how many days they're at home versus how many days they're at school, but then the school gets shut down because someone tests positive, and then they've got to close everything, so now they're home for however many weeks or whatever. So it's like trying to adjust to the new hybrid model and then having to adjust to that going back to completely being at home. It's like, it's almost like you can't.
Exactly, you can't win. And I actually
Right.
heard it from the teacher side, because we also see a lot of teachers, and it's really interesting to hear that side of the story. Is like, okay, I started prepare like every day, like from the teacher side, every day my agenda and my schedule changes. Like one day I only had, 5 kids, or we planned on having only 5 kids working remote and everyone's going to be in class. Well, guess what? Somebody in the family member might have gotten it. So now I have 10 kids online or 15 kids online. And how do I manage that? I'm like doing video and doing, seeing kids in the school, and then I'm also seeing kids remote, and that dynamic or that ratio is changing every day. And how do I keep those kids engaged online, especially when it's a high number, and I have people in person? So the teachers, I mean, geez, they need to triple their salary, because they're
Yeah.
really, I mean, every day their situation is a different thing, and the teachers are having to accommodate their structure to do that, and the parents at the same time. So, and also one of the other things I've been hearing from parents a lot is the stress on them of just the fact of, they could be the disciplinarian at home, but now I have to be the disciplinarian all the time, all day, every day. I have to be the disciplinarian with school, getting them in front of the screen and listening. Plus, once that's shut down, I have to do the same thing at home. And I've had patients, I say, I've been okay with doing that when I'm home, but to do that all day now is just not fair for my relationship with my child. And that's what I hear. It makes it very, it's creating a greater conflict in a relationship that I do not want, that I do not want to have a negative relationship. So.
Yeah. Are you seeing that, obviously you have patients already that have been coming to you because of anxiety issues, or they've already been diagnosed with ADHD or, spectrum type things. But are you seeing now even a greater prevalence of that? Like people who were not previously diagnosed, you're now seeing what I mean, obviously anxiety, but things like ADHD, more prevalence in that as well.
Yes, I'm seeing more. Actually, we're getting a lot more requests, more so for anxiety, I'd say. But in terms of the ADHD, the children that have had it, in terms of having diagnosis, the symptoms or the management of it have become more untenable. In terms of the fact that it's harder to manage because now they're in front of a computer all the time. So we're getting more of that, of like, okay, they had this and they weren't on medication, they're not on Ritalin or these medications. We've considered it, but it's managed. And then now with everything going on, ADHD, there's a big component of anxiety too with it. And so that's increasing up, and therefore their symptoms are going up. And now I have to do something about it, because this is becoming a lot more difficult to manage. I don't have all the supportive resources, because in schools you have, the teachers, but you also have other programs to support kids in general. And so we also do other childhood developmental disorders for our kids, like PANS, PANDAS, autism is another area that we focus on. But a lot of schools have these support networks or systems within them to help be able to function as a support for the parents, which are not as accessible now for them. So I would say definitely anxiety, there's way, way more requests than we've ever had. We've always had it, but the amount of requests for it, and then definitely as it pertains to like behavioral things, they've just become more heightened because they're on a screen all day. So there's less like kinesthetic, there's less hands-on stuff, there's less outlets, physically, things that all help to support, especially the growing child. So a lot of those pieces are absent, which just creates more of that more obvious clash with what was already kind of underlying, and increasing the significance of it that way.
Yeah. What are some of the symptoms or behavioral things that parents should be aware of or looking for, that they may not know might be a sign of? I mean, it seems like some anxiety is pretty simple to observe, but just other things that maybe parents might not be aware of to know when they should consider seeing a specialist like you.
So impulsivity, a child that has a lot of impulsive thought pattern or impulsive attitudes, a lot of irritability, hyper, like sometimes just in terms of the energy, but then also because that would be more of a hyperactive, but that ability to focus. So they're kind of moving from one thing to the other. If they're in class, they have to kind of all kids to a certain extent have to get some movement in, right? Especially depending on the age. But if there's a lack of ability to kind of complete tasks, taking much longer to complete the tasks, it's usually and yeah, ability to actually kind of like check that box off, or having to push and encourage in a way to get things done in a timely manner, or doing it fast, so they don't have to deal with it. So there's that piece, and then there's the behavioral, like that kind of erratic behavior. Again, lack of ability, they call like emotional quotient or EQ, ability to kind of be patient with things, and having that impulsivity too is a really common symptom.
Yeah, because I would think, just in general, I think that activity level in children has gone down so much, just the way that our society is, and being in front of screens all the time, or on their phone, or playing video games, or whatever. And I feel like they're probably even more restricted now, especially being home, because they wouldn't necessarily, I guess the opportunities to interact and play with other kids and do things and be outside is probably even more restricted now. So how much of it do you think is, just the fact that they're just not getting enough activity, versus there's really something going on that you would say diagnose as, ADHD
Yeah, and
or something like that?
that's a good question, because all children need to be move and to be active. And so at some point there is going to be a lack of patient. I mean, even adults, what is it? They say when you give a presentation, it's like, what, 20 minutes? I think that's the saying. Like you
Our
can have
attention span.
20 or 30 minutes, right?
Yeah.
For attention span. So it's the same for children. So the schools should really be doing, and I am hearing that. I don't know if it's consistent across the board, where they are, for their young kids, having them take a break every 20 minutes because of that, and knowing it. Hard for the parents that are working from home, though, because if you're trying to work from home and you're trying to accommodate to that, that's not like the easiest thing. But from what I know, no one with the younger kids at least trying to take that 20 minutes. So I think realizing that piece, like just even as adults, our attention span will start waning at a certain period of time. So you want to build in, what I'm telling parents is like as many interactive things you could do. The same as I'm telling parents that are like working from home, like in the morning, especially in the morning before the day goes, I'm like, okay, try to do the exercise, 30 minutes. If you have a lunch break, trying to get up and move. And in naturopathic philosophy, there's kind of these like, some of these core tenets that we say is like these base foundations. And one is like, hydrotherapy is one, but one of them is walking outside in nature for 20 minutes a day. And so I know it's cold now and it's hard for people to do that, but a lot of kids will bundle up. I just saw my nephews, and I was outside, and what was it, yesterday, and I was laughing because I could barely stay out. It was like 2 hours.
They don't care, though.
That was why I'm saying that. And I'm
Yep.
like, to my sister, I'm like, aren't they like, and she's like, oh, they're totally used to it because their school is actually, they're in school. But she said like most of the time, like at least half the time, they have them outside. So they have all this, it's kind of cute, like all this preparatory gear, like they have to have these big snowsuits and all these like things that are bundled up. So it's just amazing how kids are way more,
Adaptable,
versatile and adaptable, and than we think. Like even with the masks, I was worried at first, are they going to be able to wear it? And I mean, it's like, they're totally covered. They don't have it below their nose. They're not even thinking about it. It was amazing to watch. Like it was just part of their everyday. So I think sometimes we assume sometimes, obviously that's not the case for all children, but it was just amazing to watch. And then have almost a little
right.
more time than adults at that, with playing outside, and they just totally accommodated. So it was great with that school. When I would recommend is there's a lot of outside recess play for them, and they just make sure they have tons of coverage, way more than maybe normally, just because they're outside. Even they said unless it's below 20 degrees, obviously, but for the most part they're outside. So I try to say like walk outside, do something physically active first thing in the morning, which you could do with the whole family. And then in the middle of the day, if there's something where there's like a recess or activity that you could do for 20 minutes, so that especially something outside that will help to break that. But if the kid is still as much as interactive play as you can. So hopefully it's a lot harder for my parents that have, single children. This has been a blessing for people that have had like many kids, because they can interact with each other. So as much as you can create interaction, and so usually, yeah, like exercise, physical activity, that's allowing maybe not person to person interaction, but it's allowing like kind of letting that outlet out. And so if you're building in all of those things for them to do, and there's still that challenge, even with the breaks, by video and things like that, that's when you want to consider, is this kind of something that's been lingering that you need to put more attention to than before,
Right.
that you might have not noticed before.
Yeah, exactly, exactly. So what would a parent expect when they come to see you as far
Mhm.
as how you evaluate and then your treatment plans? And obviously it's individualized, but just, if you could give us some general ideas.
Yeah, so I'll talk to you. I always say the saying is like, I am a naturopathic doctor, but I'm not your naturopathic doctor. So I will share some things that I always look at when I'm working with children with ADHD, ADD, as well as oppositional defiant disorder. So one of the pieces is with ADHD and ADD, there's typically an imbalance with dopamine and norepinephrine, those two neurotransmitters in the brain. And so lots of times, if you look at the medications for it, like Ritalin or Adderall, they work particularly towards those neurotransmitters. They say for ADHD, the brain is more in like theta, right? And so it might take, which are brain waves, in terms of sleeping waves. And actually, to relax, you have to be oftentimes more in a theta. But then what that could cause is that issue with, like what I just said, completion of a task, ability to focus, all of those other pieces, right? And so those medications help to work particularly for like the dopamine as well as the norepinephrine, which are more like norepinephrine, for example, are more stimulate, what they call excitatory neurotransmitters. And so if it's excitatory, it means that it's causing that brain activity to cause that like hyper excitability, that impulsive behavior, ability to kind of sit and complete tasks. So norepinephrine, high amounts of norepinephrine will cause that. And so the medications will help to work particularly on that. So one of the things I do is I do check that. So I will do urinary tests or salivary tests to check on their neurotransmitters for children to see what that's balanced as. And then I'll also check sometimes the cortisol levels in terms of like that flight or fight. So that is also checking for the stress response. So that's one thing I want to look at. The other thing for kids, the first thing, especially depending on age, the gut is like everything for children, because 80% of your immune system, actually, I think it might even be more than that, when you're really little, below 2 or 3 years old, is in your stomach. And actually, about like 80% of your neurotransmitters are in your stomach, especially as you're younger. And so some of the most key ones are serotonin. So lots of times children with ADHD or ADD have issues with their serotonin levels. There's an imbalance, like they have their norepinephrine's high, their dopamine might be, but their serotonin is low. And the serotonin is more of what they call an inhibitory transmitter, so neurotransmitter. So that's something that they put in like SSRIs, like things you might be familiar with, medications like Prozac to make you more relaxed. So they're having lower serotonin levels, which are those things that make you more relaxed. And sometimes that's another reason why I like to check. We might need to put them, children on something to increase their serotonin levels, so their neurotransmitters are just balanced in general. Like they're more even. They're less like, they're less far apart. And so we look at that. Then the other thing I look at is just initially with kids, so the gut is one of the pieces, looking at a good probiotic. There's so many different kind of probiotics depending on, there's ones that are studied specific for anxiety. There's spore-based probiotics, which we use for children a lot because they're not out in the dirt and getting the spore-based probiotics they usually do. There's just regular ones. There's ones for like candida. And so there's many different things depending on what's going on. But I usually always look to put a kid, even the young, like even babies, on good probiotics, especially if there's GI issues like constipation. Sometimes babies, all I put them on is a probiotic that's constipated, and that fixes, everything. And again, because most of the stuff at that point, in terms of immune function, in terms of neurotransmitters, is all in the gut. So I look at that. The other thing is like I said, the minerals. So there's tons of studies that, over 50% of children with ADHD or ADD have a magnesium deficiency. So it's very high. So you can see pretty significant changes. Like any child that I have on magnesium, there's definitely different forms. There's magnesium citrate, there's magnesium threonate, That one is very popularly known to help cross the blood-brain barrier, to help to relax the brain. So magnesium, what it does is it vasodilates, so it relaxes the blood vessels in the body and circulation. But a lot of people in the United States are deficient in that mineral because we're not getting it from the like green leafy vegetables that we used to, right? So not only are we not consuming as many
I
green
was
leafy
going to say,
so that's the
I
other thing,
mean, right, the nutrient level in our food in general
is
has
already
dropped
lower.
a lot. Yep.
Yeah, so the nutrient level is lower, plus we're not also consuming it as much. So it's like you got a double whammy. So when you check, I think that that's one of the top, like that and selenium. Magnesium might be number one, is I think in the high in terms of deficient, right, mineral deficient. And so for most kids, I'm always going to put them, especially with ADHD, it might be like a multi-mineral, but definitely one with magnesium, and that will also help balance the system. So you'll put a kid on magnesium and they might be a lot more relaxed, they might be a little less anxious, they might be a little less irritable. So magnesium is one of them. I also look at like their copper to zinc ratio. There's been a lot of studies with zinc that like if they're deficient in zinc, zinc is connected with the inability, in terms of not being able to focus and the mood. And so when you're getting them on proper zinc levels, if again they're deficient, you have to check. That can also help. And then another thing is, I'm just doing a few top things, iron. So with children, you always want to check their iron levels and ferritin. And so oftentimes they do check it. We don't check it all the time for adults. I actually see adults with ADD and ADHD too. And so I check that for my adults too. So kids are often do have issues with iron. And so they've shown actually studies that there's kids with ADHD often that there is a higher chance of lower iron levels. And so if you actually look at some of the medications like a Ritalin or Adderall, if they actually increase up, if you test in the blood, the iron levels will go up higher, which is interesting when they're on those medications. So iron is another thing I check. And you have to think, and it makes sense because iron gives you oxygen to your blood, right? And so if your iron is low, or even if it's borderline low, you're getting less oxygen to your body and less oxygen to your brain. If you have less oxygen in your brain, you're not going to be able to function as well. So I also definitely check the iron levels if I'm just doing a regular blood count for someone that I first am working with.
Yeah, that's all great things. Makes perfect sense too when you think about it. As far as just in general, I know we just said, we're not getting as many nutrients in our foods as we used to, but what do you recommend as far as changing the child's diet?
So I usually try to do more, and what we just mentioned with like the dark green leafy vegetables, I try to have them have a much higher plant-based diet. That's the first focus, because with kids, it's always hard to incorporate to get them to eat vegetables, right? So
Yep.
I try not to do a lot of I kind of do the same with all my patients. I always try to meet people where they're at. Everyone has a different style in terms of naturopathic doctors. I'm not the kind of person that's going to come in and be like, we're going to take you off gluten, dairy, this, like all these 50 things. Instead, I usually try to say, what do you need to have more of? If I have someone that's already really great with their diet and now they're trying to tweak it more, of course, we're going to run with it. So again, it's going to be depending on the person. But if someone has never done that as much before, especially kids, what I try to do is instead incorporate more of the good things. So it's going to be those dark green leafy vegetables, and also trying to extend their number of foods. So with kids, oftentimes there's a lot of studies on this because I did a lot of work around like childhood obesity. And with kids, they say the most important time is before they're like 5 or 7 years old, is introducing a lot of different vegetables, because you pretty much as an adult will stay with those same group of 10 or 15. Think about the food vegetables you eat. I'm the same,
Sure.
you kind of stick with those 10 to 15 for the rest of your life. So that's why a lot of the studies say it's like, that's the best, even if a kid turns it down. Like even if a kid is like, no, oftentimes kids have to see it like 4 or 5 times before they're going to try it. So it might be some wasted food, but to continue to incorporate it, even if it's something they might reject, and to allow for like a greater variety of food. I try to get them to incorporate more vegetables. So a lot of times if I have boys, or girl, boys or girls. Boys, I find it tends to work better when I'll give them a handshake of like, okay, we're going to eat this. And they give me a handshake. And when I say, I'm going to follow up with you about it the next time, and they do it, the girl, girls usually just have to say, that's just my experience. And they, will typically are more, adjustable to it. But it's usually, I kind of like make a deal with the children to say like, okay, we're going to do this. I know you don't like vegetables, but can you do one of these things? Like have a cup of broccoli, like for every meal. And most kids will agree to that. I think the part when they get hesitant is when it's like they're removing all the stuff they love. And
Right.
so if I can try to get more nutrients in them, I try to do that. And then again, the minerals and the multivitamin, things like that to help support it if they're not getting it in the other ways.
Sometimes it's just a matter of changing the way it's prepared too. Like,
That's true.
I'm a perfect example of that. My mother used to make Brussels sprouts and she basically boiled them. They were awful. They were awful. And then
Oh
I
yeah, the
guess,
crispy out in the oven are totally different.
oh my God, yeah. Well, I never had a Brussels sprout that way until a friend of
Oh,
mine,
that's
we were
so
at a
funny.
restaurant and she was like, just try. I'm like, Brussels sprouts? Ugh, no way. She's like, come on, trust me, just try them. I'm like, okay, fine. This is like 20 years ago, but still, I mean, yeah, I
But
mean,
see,
it
you're
was,
saying that, and that happens as an adult. Like where
yeah,
I'll recommend to adults, like, oh, we're going to be doing fish. Actually, especially Caribbean, we're going to be doing fish oil, and they're like, oh, I used to have to do cod liver oil going, back to school, and it's like almost a traumatic like an
yeah,
experience of
you're
what they remember.
traumatized.
And they won't, and I'm like, no, the cod liver oil doesn't taste anything like that from like 20 years ago. So it's the same with like with foods, as we have to. That's perfect thing is change it around. And with kids, one of the biggest things I notice is texture. So it's kind of funny because like kids are more into the texture sometimes than the taste. So
Mhm.
it's oftentimes easier because I work with a lot of kids with food sensitivity, food allergies and food sensitivities. And like, let's say they have to remove gluten and dairy but they love pizza, and we'll do the alternatives and they're totally fine with it because the texture, the crunch, the
Right.
gooiness of it. But the funny thing is the adults are not, because we're used to a certain taste. That's why it's funny. The adults
Exactly.
are like, I don't want to do this because we know the taste. Whereas for
Yep.
kids, like they just like the texture feels the same and they're totally fine with it. It's kind of hilarious. Is the adults that have more of a problem with it because we like know what it's supposed to taste like, so it just doesn't taste right to us. Whereas for kids, it's like if the texture feels the same, they're pretty okay with
Well, we're more ingrained in, what we like and what we don't like. And
it.
that's too funny. Awesome. Well, before we finish, anything else that you wanted to let us know that we didn't cover?
Yeah, the other thing is with all the basics I try to do. So I did talk about testing, which is great that naturopathic doctors can do. You want to definitely work with a naturopathic doctor that focuses on like pediatrics, has an interest in it, like less of a broad experience, but also pediatrics, because there will be more specialized testing, that they may or may not be familiar with. But I always like to go. So I talked about testing, but whenever I see someone, I always like to go back to the basics, like the food that we talked about, right? Activity, we talked about physical activity, but the third thing is always like sleep. So sleep is huge for children in general because it's obviously part of growing, but there's a lot of hormones that get released for kids, like growth hormone, which gets released at night. Serotonin levels go up, and like I mentioned, serotonin is often imbalanced for a child with ADHD, and so we need to make sure they're getting as much as they can. And so it's really, really important for a parent also to work with the sleep for kids, especially with ADHD. I try to tell the parents, which I know is hard, to not have their kids, on a laptop or tablet, TV, like an hour before they go to bed, because actually every time you're on that, it pings up dopamine levels and norepinephrine levels. And I just said those are two neurotransmitters that are imbalanced. So I try to have that for all kids, and like I say, at least a half an hour, but we're boosting that up. And so what can happen is you'll see a kid that like only gets 7 or 8 hours of sleep. So their sleep quality is not good. And so that's a time where the brain repairs, kind of declutters, cleans itself out, same as the immune system, and then ready to go the next day. So if you're if you're interfering with that, that can just make the symptoms more exacerbated. So sleep is really, really important, equally as important. So much to the point that I had actually it was cool. It's cool when you see it clinically by way of like laboratory tests. So I had a one patient, she was I think 19. Yeah, she was pretty young. The numbers, the dopamine levels were like through the roof, actually, and norepinephrine through the roof at like 11 o'clock. And something told me, I don't know why, because I had said, oh, do you do like video, are you doing video games or something at night?
Snapchat,
And
come on.
the look was like, and I was like,
Yeah.
yeah, I'm a gamer. So the person, and it was through the roof, and it was like it was actually a funny story because she's like, wow, like you can really see that in the neurotransmitter test, because it was like, and after we did it again and we worked on that, it was actually really helpful because then I got to say, see, this is why you can't be doing this like right before you go to bed, because look at how much it's going to impact your sleep quality. So it's
That's
cool to
awesome.
see the post test 3 or 4 months later to see all those numbers come in range, but it was really clear. And I asked that, and that was like, that's the times that the test was, it was exactly the time that she's like most stimulated by it. So it was cool because we know that, I know that scientifically and based on the states, but it was interesting to actually see like clinical anecdotal with actually change in lab tests with it. So it definitely affects it. So sleep is really, really like all those basic fundamental food, like I said, physical exercise and sleep. Those are the core things to work out. And then obviously mineral deficiencies, and then things that are specific to them. There's a lot of adaptogens that are supportive. There's things like nutritional lithium that's been talked about and studied as well that has to be managed and prescribed well. Not the medication lithium, but like
Right.
nutritional lithium, like lithium orthate. So there's many different pieces, but those core foundational things I always say are the first things to work with, and then from there you kind of expand.
Yeah. The recommendations of sleep are great. I'm glad you mentioned that. And for adults too. I mean, we're on our laptop and phone and screen till, all hours of the night
We
also.
fall
It's not
asleep.
just
We fall
kids.
asleep in front of our TV,
Yeah.
and some people that's what makes them go to sleep. So I think for some people they say it makes you go to sleep, but also makes you stay up. So
Yeah.
I used to kind of think that too, like, oh, I kind of fall asleep easier, but I'm like, yeah, but when you really think about it, also forces me to stay up an extra hour than I normally wouldn't have. I would have went to sleep. So
Hmm.
it just becomes this habit that you really just have to break slowly over time. So that's why I'll tell people to start in baby steps instead of, ideally it's supposed to be like 2 hours before bed or an hour. I know that's hard for most people. So I'm saying, okay, let's start off with like 15 minutes. Let's start off with 30, then 30 minutes and try to build. And that usually works a little bit better for kids and adults when you're doing it in increments. So it doesn't feel like it's impossible of a thing to do.
Right. Right. Awesome. Well, all this information has been amazing. How can people get in touch with you if they want to reach out to you, to either, book appointment or just for more information?
Yeah, sure. So I run a multidisciplinary integrated medical practice. So we're based in Fairfield. We do see people in person, but we also do telemedicine and concierge. We have all three models in our office. So we're located in Fairfield, Connecticut. So it's pretty easy to remember. Fairfield, Connecticut, Fairfield Family Health, and our website is fairfieldfamilyhealth.com. And the phone number is 203-254-9957. And for new patients, you would ask for Gloria. She's the person that's the new patient coordinator. And our email is info@fairfieldfamilyhealth.com. So definitely check us out there, fairfieldfamilyhealth.com. All of our social media handles are at Fairfield Family Health as well. And we also do like 10-minute like free consults for folks that are just curious to ask more specific to them and how we can help support them, or if it's a good fit, we're more than happy to set that up actually with any of our providers at the office.
Okay, awesome. Great. So people can find you at fairfieldfamilyhealth.com, and this podcast lives on our website at naturalnutmeg.com and on our social media sites as well. And we'll be e-blasting this out to everybody via email. And thank you again so much, Dr. Jaquel, for being with us today. It's great information.
Thank you. Thanks so much for having me.
Absolutely. Great. Thanks, everybody, and hope you all have a great night.